U.S. downhill ski legend Lindsey Vonn crashes in her last race before the Winter Olympics. In this video, we'll break down the footage and we'll analyze the mechanism of her injury. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel, we analyze the science of sports injury. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. Her race is occurring in Switzerland, and as she comes down the mountain, it's right about at this point where she starts to lose control, and then she slides into the safety netting here. There's 2 points during the fall where her knee injury could have occurred, and we'll take a look at both of them. So the first one is when she's coming down, she's still in control, she's in the air, and when she comes down to land, what we're looking at is her left knee. Before or prior to her skis making contact with the snow and ice here, if you take a look at her left knee, we can see how her left knee is almost in a straight or a fully extended position as she lands, and we can see that little bit of a torque, that little bit of a hyperextension into her left knee as she lands. And when she does that, that's going to place a lot of stress on the internal structures of her knee, mainly her posterior cruciate ligament and her anterior cruciate ligament. When your knee hyperextends like that, it's going past beyond the normal physiological range of motion, and that is going to stress the internal soft tissue structures of her knee. Subsequently, a couple seconds later, she loses control. She starts to spin out with her legs in front of her, and as she does this, again, we're going to take a look at her left knee. As her body weight shifts from her left to her right, we can see how her ski boot is, of course, still fixated to her ski here with the bindings, but as she falls back with her foot still attached to her ski, again, that is going to stress her knee. In this position, that almost recreates an orthopedic test called an anterior drawer test. And with the anterior drawer test, that is checking the relative movement of your tibia, the lower shin bone, relative to the femur, the upper thigh bone. Or in this case, it's actually the femur moving posteriorly or backwards because of her ski boot is still in the bindings here. So her femur is moving backwards or posteriorly relative to her lower leg. And what is that going to do? That is going to recreate an orthopedic test called an anterior drawer test, which will stress her anterior cruciate ligament. We do have to mention that she did actually ski back down the mountain herself, very slowly as her race was over. But upon doing so, you can see her grasping her left knee here and checking the mobility of her knee. And at the end of the video here, we can see her being airlifted off of the mountain. With the use of the anatomy screen, we can appreciate the bony structure of her left knee. So when she initially landed after being airborne coming over that jump, that is going to force her knee into a slight hyperextended position, which will stress her anterior cruciate ligament and her posterior cruciate ligament, in addition to causing compression in the front of her knee and then tension and stretching in the back of her knee. But then subsequently, when she did fall, she fell backwards with her ski boot still in the binding, and again, that is going to stress the same structure of her anterior cruciate ligament. This fall does come at a very poor time for Lindsey Vonn, as the Olympics are just about to start here in Italy. Hopefully she's doing well. Thank you very much for watching today, and please be well.